Upper eyelid hooding. First of all, what is upper eyelid hooding? This is when patients have too much skin on their upper eyelids, particularly towards the outer edge. And that drops down onto their eyelashes, or maybe just drops down over the area of the upper eyelid, if they're a woman, where they would put their makeup. It can get in the way of the vision. It can feel heavy. So first of all, before treating, I assess the patient. I ask them how long they've had it for, how it interferes with them, whether it's purely a cosmetic problem or whether it's more of a practical problem, like they can't get their makeup on or it's touching the eyelashes, and as soon as they put the mascara on, it runs. Sometimes it can cause headaches because they're trying to lift their eyebrows during the day to try and lift the weight of that eyelid hooding off the eyelids. And so they're fine for the first half, but towards the end of the day, they're very tired. And there can be some descent of fat behind the hooding that can feel heavy. And the actual presence of the hooding can interfere with the visual field and cause them a medical problem for which they really have to have the surgery. The treatment of eyelid hooding is eyelid surgery. It's upper eyelid blepharoplasty, meaning oculoplastic surgery on the eyelid skin with a little bit of the underlying muscle just removed to debulk it so that everything fits nicely. This surgery is delicately done under local anaesthetic. Your surgery will be done here at Clinica London. You're invited up about an hour before and you see the nurse for the pre-assessment where she goes over the post-operative management of the surgery, and we both go over together, we both go over the consent form. The eyelid surgery under local anaesthetic involves sitting initially in a very comfortable operating chair, come bed, it can go up and down, and I mark the skin crease and then I mark the amount of skin that has to be removed. It's very important that this is done under local anaesthetic, because then you are what we call fully cooperative and aware. It means you can look up and down, you can sit up and down, and we can judge exactly the right amount of skin that needs to be removed to correct your hooding. The other thing that's important is that you bring along some photographs of what you looked like when you were younger. Because the last thing I want to do is change your appearance from what you really are. So if you, for instance, have always had a low skin crease, because that runs in your family, then the last thing you want me to do is to put it higher. So I have to see what you looked like, say when you were about 20, 23, 25, and make a judgment on that with you, make a decision of where to put the skin crease.